How does a sweat chloride test diagnose cystic fibrosis? Imagine a simple test that can reveal a hidden genetic condition by measuring the salt in your sweat. That's exactly what the sweat chloride test does for cystic fibrosis. This test works by measuring the amount of chloride, a key part of salt, in your sweat. People with cystic fibrosis have mutations in the CFTR gene, which causes problems with chloride channels in their cells. These channels are like tiny gates that control how chloride moves in and out of cells, especially in sweat glands. When these gates don't work properly, chloride builds up in the sweat, making it saltier than normal. To perform the test, a small patch of skin, usually on the arm or leg, is prepared. A chemical called pilocarpine is applied to stimulate sweat production. Mild electrical stimulation then encourages sweat to flow from the sweat glands. The sweat is collected on special absorbent paper or gauze. This sample is sent to a laboratory where technicians analyze the chloride concentration. If the chloride level is high, it suggests cystic fibrosis because the defective chloride channels cause chloride to leak out into the sweat. Doctors interpret the results based on established guidelines. If the chloride level is less than 30 millimoles per liter, cystic fibrosis is unlikely. If it falls between 30 and 59 millimoles per liter, the result is considered borderline, and further testing such as genetic analysis might be needed. When the chloride level is 60 millimoles per liter or higher, it confirms a diagnosis of cystic fibrosis. This test is especially useful for newborns and young children, often performed after 48 hours of age, especially if they have a positive screening test or a family history of CF. The sweat chloride test is regarded as the gold standard for diagnosing cystic fibrosis because it is highly reliable when performed at specialized centers. It helps doctors confirm whether a person has CF by detecting the elevated chloride levels caused by the faulty CFTR gene. Early diagnosis through this test allows for timely management and treatment, which can significantly improve health outcomes. Remember, if you or your child are being tested, always consult healthcare professionals for interpretation and next steps, as individual results can vary and medical advice is essential.